Now let's take a look at viewing the past visits for a patient. The Past Visit view can be opened by clicking the Past Visits link in the Patient Visit view. On opening the Past Visit view, you would see a summary of all patient visits as shown by the top left Visit Type drop-down box. On the left-hand side, you would also see each individual visit date. On the right, you would see the summary of individual visit. At the top, there would be known allergies, known critical illness history with dates as per your entries. The latest visit for this patient is visit number 18. Here you can see chief complaints, observations, advice given, diagnosis, prescriptions, investigations and visit charges. You can simply scroll down to see details of each such visit. If you want to jump to a particular visit, simply select the visit on the left. The right side view will be adjusted accordingly. If instead of all visits you want to check only the routine visits, not a problem. Select routine from the visit type drop-down and only the routine visits will be shown. This helps doctors to quickly filter visits for a patient based on immunization, routine, emergency and so on. The summary view does not allow any modifications. The detailed view does. You can switch to detailed view by clicking the View Details link. The detailed view shows visit by visit view. Let's say a patient comes back with investigation report and you want to make some quick notes. Click the Investigation tab and edit besides the investigation you want to make notes against. Enter your details and click Save. The investigation details get saved. If you want to do a follow-up sitting of a procedure, select the Procedures tab and say, Add. You could now enter the procedure name, say, Root Canal. Then enter the date and tooth location. The tooth location is showed only if the practice entered by the doctor is dentist. Finally, click Save. You can also attach any follow-up documents/scanned reports to the past visit. All these changes are possible only in the detailed view. If you wish to switch back to the summary view, click on the Visit Summary link on the left again.